Hey guys, this is Diego from Chile. Today, we're going to play Clinical Sense. For those of you who are not familiar with it, Clinical Sense is a role playing game where the user becomes a physician and has to deal with different clinical scenarios. Although I'm a medical student, I have been able to deal with emergencies, surgeries, pregnancies, and much more. Inside the app, of course. You might be familiar with the World Health Organization. Well, this year, the theme for World Health Day is food safety. And this is what today's case is about. So, let's start. Okay, so now I've got to choose between a developed world or a developing world. I guess I'm gonna go with the developing world, so let's see what's going on. Okay, another fine day at the hospital. Yeah, it's a fine day. Well, there seems to be some kind of diarrhea outbreak, she tells you, while leading in the first patient of the day. This should be fun. Oh, yeah. Well, the first patient is 7-year-old Davy, who was brought by his mother. Oh, he looks bad. Okay, so he had fever for 2 weeks. It started at night and resolved by morning. And in the second week, he experienced episodes of diarrhea without blood or mucus. He also complained of recurrent headaches, as well as occasional epigastric pain. Okay, well, this really looks like an infection, and maybe I should think of Escherichia coli, hopefully. As his fever did not resolve, and because his general condition began to deteriorate, his mother decided to bring him to your clinic. Okay, so, um, no important things in the medical and surgical history. So, he looks lethargic. He's dehydrated. His temperature is 100 Fahrenheit. He's got a pulse rate of 100 and a blood pressure. Okay, that's alright. The abdominal examination reveals tenderness in the right upper quadrant and lower abdomen. The liver is not enlarged, but a soft spleen is palpable just below the costal margin. And no other findings. I decide that Davy is best treated inward, and okay. Yeah, I should rehydrate him. But what else should I do? Oh my god, this is difficult. I think I'm gonna start empirical antibiotics. Okay, hopefully this will go right. Okay, Mr. Dackle, 45 years old. He was treated with antibiotics for cellulitis of the right leg. He says he's drowsy. Okay. Oh, this guy is really dehydrated. Oh, I'm gonna ask a surgeon. Let's see what happens. As you get ready to leave, one of the nurses rushes in. Doctor, could you please do me a favor and take a look at my cousin? Let me guess, she also has diarrhea. Yeah, of course she has diarrhea. So this is like a very similar case. Oh, she's got medical reports. Yeah, there was a stool culture, and it is positive for Escherichia coli, but the serotype was not determined. Yeah, that's important, I think. I'll start oral rehydration and antibiotics as well. Yeah, I won't give her antidiarrheals. I've been told that I shouldn't do that. As you leave the hospital, you feel satisfied over your management. But should you be? Oh my god! Okay. I think I failed, but at least I didn't kill my patients. So, in this try, I got 50 out of 100 points. That's my score. What I could do next is to check what happened. So, oh, okay, so this child had typhoid fever. I didn't even suspect that. I gotta be ashamed, or I really gotta go studying. There's a chance for me to review everything, antibiotic agents that are useful for typhoid fever and many other things regarding the presentation and the management. So, yeah, this is a very good clinical experience. So, I invite you to come and see what you can do in a developing world or a developed world with patients coming because of foodborne illnesses. This is Clinical Sense. Come join us. Please go to the App Store and download this application for your iPhone or your iPad. Or as well, you can go to Google Play and download for your device.